So welcome to our webinar tonight. I'm Dr. Rita McGuire. I'm Chief Medical Officer for Wakana for Life. And tonight's topic is CBD and endometriosis. I'm also one of the co-founders of this amazing company. And more importantly, I forgot to tell you that I'm an obstetrician gynecologist. So endometriosis is one of the disease entities that's very near and dear to my heart because I have so many patients that suffer from this very debilitating and chronic condition. So what exactly is endometriosis? Well, endometriosis is a very, very painful disorder. It affects about 10% of women. And what happens is that the endometrial tissue that is lining the uterus or the womb here, this tissue is found outside of the uterus. And the way it finds itself outside of the uterus is that when a woman has a menstrual cycle, you know the blood should come out of the uterus and through the vagina. But what happens in endometriosis is that there is something called retrograde menstruation. That means the blood, instead of coming out of the vagina, it goes back up through the fallopian tubes here and implants on the ovary, it implants on the uterus, it implants on the uterosacral ligaments in the pelvis. It can even implant on the intestinal tract. When that happens, this tissue starts to grow. It causes severe pain. It causes severe swelling and inflammation. And it can also accumulate and develop cysts. This scar tissue and adhesions can cause long-term and debilitating chronic pain, pelvic pain, but it can also cause infertility, not allowing women to have children. So one of the primary symptoms of endometriosis is pelvic pain. It can be associated with the menstrual period. And it also can cause lower back and abdominal pain during those monthly periods. It can cause severe pain during intercourse. It can cause painful urination or bowel movements. It can cause intramenstrual bleeding or heavy menstrual bleeding. Again, it can cause an inability for one to become pregnant. It can cause bloating, nausea, diarrhea, or constipation, which can often be mistaken for inflammatory bowel syndrome. And it can also cause fatigue and or muscle weakness. The way we diagnose endometriosis is that we do a very thorough pelvic exam. The pelvic exam can allow us to feel if there's any cyst or scarring. It can also allow us to find out if the uterus is retroverted or what we call pulled down by the adhesions that are occurring in the pelvic area. We also use an ultrasound. This ultrasound can be used to look for signs of cyst formation as well. An MRI can also be ordered. The MRI, again, can show us if there's implants outside of the uterus. It can show us the size, and it can really help us to determine what sort of surgical procedure that woman needs. Now, a laparoscopy is a tool we also use to diagnose endometriosis. And what we do is we make a small incision near the navel, and we put what we call a laparoscope or a telescope inside of the pelvic area. And we look around, we take tissue biopsies, and we look for what we call a gunpowder. Endometriosis has a very distinguishable appearance when we look at the pelvis. It looks like gunpowder. It's dark black typically or brown in the pelvic area. So let's talk about some of the conventional treatment options that we typically use for endometriosis. It can involve medication or surgery. Typically, we start out with pain medication like non-steroidal anti-inflammatory drugs like ibuprofen, Aleve, Advil, or we can use even stronger medications like opioids, like Norco. We have hormonal therapy. One of the first lines of hormones that we use are birth control pills. Birth control pills will help slow down the periods, which will help slow down the implants. We also can use GnRH or progesterone and even aromatase inhibitors. So those are really big words, but those are hormonal therapies that we can use to eliminate the pain of endometriosis. Again, conservative surgery includes a laparoscopy where we kind of burn the implants or remove the implants. For more severe cases of endometriosis, of course, will be a hysterectomy. So removing the ovaries, the tubes, and the uterus. Again, we wouldn't want to do that if a woman wants to have children. So the laparoscopic surgery would be for those women who want to conceive children who have endometriosis. And then there's some home remedies, warm baths, heating pads, and again, those over-the-counter pain medications. Some alternative medications include also acupuncture. Acupuncture has been used very successfully to provide some relief from pain. But CBD, of course, is another alternative option and showing a lot of promise to use in women who have endometriosis. And we'll talk about the anti-inflammatory properties that CBD has and the analgesic properties that CBD has to reduce pain. So what is CBD? CBD stands for cannabidiol. Cannabidiol is the second most common cannabinoid found in different strains of the cannabis plant. It's the most common cannabinoid found in the hemp plant. Unlike THC or delta-9 tetrahydrocannabinol, which gives us that high or euphoria, CBD has no mind-altering effects. Now, when we look at the plant, the cannabis plant, it has two species. It has a marijuana species and it has a hemp species. We know that CBD can come from both the marijuana and the hemp species. The difference is that the marijuana species has a high THC level and a very low CBD level, and the hemp species has a very high CBD. And for all practical purposes, the definition of industrial hemp is containing less than 0.3% of THC. So you see the difference between marijuana hemp, and you also see that CBD can come from both species. Tonight, we're specifically talking about CBD being extracted and coming from the industrial hemp plant. Let's look at the other cannabinoids that the plant makes. There are other cannabinoids, but you see the main player, the hero, is CBD. CBD has many, many medicinal properties. It's an antibacterial. It inhibits cancer cell growth. It promotes bone growth. It reduces seizures and convulsions. In fact, the media in 2013 really made CBD more of a topic when the little girl, Charlotte Figi, was really helped by her seizure disorders with CBD. CBD also reduces blood sugar levels. It reduces the function in the immune system. So when those people who have and patients have autoimmune diseases, it is very helpful in lupus and fibromyalgia, scleroderma, to name a few. It reduces inflammation. CBD reduces the risk of arterial blockage. It also reduces small intestinal contractions. It helps to reduce vomiting and nausea in those who are undergoing chemotherapy, or even our moms that have nausea and vomiting in the first trimester, or even hyperemesis gravidarum. CBD relieves pain. It's a great analgesic. In fact, it's been used for over 5,000 years for pain relief. It also relieves anxiety, depression. It slows bacterial growth. It suppresses muscle spasms. You know, the uterus is a muscle. So that's why CBD is very helpful in those women, not only who have endometriosis, but who have menstrual cramps. CBD is tranquilizing. It treats skin disorders like psoriasis and eczema and acne. And CBD is also a vasorelaxant. Well, let's look at Delta 9 THC or THC. It reduces vomiting and nausea, relieves pain. It stimulates the appetite, really important in those who have HIV or AIDS, or even undergoing chemotherapy whose appetites need stimulation. And it also suppresses muscle spasms again. The other cannabinoids that you should be aware of that also have medicinal properties are listed here: CBDA, CBG, CBGA, CBC, CBCA, and Delta 8 THC, and my favorite, THCV. A lot of studies done on THCV and its role in weight loss. So you can see a full spectrum product is important to have the more potent effect on a cellular level. So how does CBD and the other cannabinoids work? Well, they work by the endocannabinoid system. This system was discovered about 30 years ago when I was in medical school at Wayne State School of Medicine, and it was deemed the most vital regulatory system in our body. It actually modulates and regulates how we think, how we feel, how we react, our pain, inflammation, our anxiety level. And this system is made up of endogenous cannabinoids. Those are cannabinoids that our body produces. In fact, one of the cannabinoids, anandamide, is very, very prevalent and found in high amounts in breast milk. The system is also made up of receptors that are found not only in the brain and the central nervous system, also in the immune and the periphery, but these receptors are found in the reproductive organs. In fact, you'll see in a later slide that the uterus has the highest level of CB1 receptors that are looking for cannabinoids. These receptors are found in the lung, the vascular system, the liver, the colon, of course, the immune system, the spleen, the pancreas, the adrenals, the muscles and bones. So these receptors are found throughout every organ and gland in our body. So CBD for endometriosis is currently being used to decrease the inflammation and to decrease the pain. Again, CBD interacts with the body's endocannabinoid system, CB1 and CB2, and these receptors are found in high levels in the uterus. And because CBD also decreases muscle contractions and spasms, remember the uterus is a muscle, so it is beneficial in helping to relax the muscle during inflammation and pain, and even during times of the menstrual cycle. So again, this slide is very blurry, but I tried to make it as clear as possible. But the highest amount of CB1 receptors are found in the uterus. And again, the uterus is the organ where endometriosis is affected. So CBD also may be helpful, again, in reducing pain and inflammation. So let's move on to Wakana and about our company, because I really want you to know, if you're a guest on the line, about Wakana and who we are. Wakana was actually launched on April 20th of 2019. So we're just about 5 months old. And it was brought into existence through the synergistic efforts and shared foundational values of 4 African-American women who believe that health, wealth, legacy, and freedom are gifts that belong to all people. Here are the 4 co-founders. Our CEO is Melissa Boston, and she brings over 30 years of experience in the home-based arena as well as in sales. She is a social media strategist. She has business in over 40 countries and has really trained and coached over 50,000 distributors. This is her vision. Wakana was given to her, the name, the vision. She is our visionary behind Wakana. Our president, Dr. Patricia Van Pelt, is a state senator. She's an evangelist, an entrepreneur. In fact, she's serving her third term here in Illinois. She has truly given us the pathway to ownership. There's an opportunity of you owning a part of Wakana. And our senior VP of sales, again, 30 years of experience in the service and sales industry. We call her our midwife, where she is able to birth opportunities that each and every one of us has in this cannabis arena. And then myself, Dr. Rita McGuire, I'm an obstetrician gynecologist. I am the chief medical officer for Wakana. I bring 3 years of experience in studying this plant, and I'm also very active with the medical marijuana and the adult use law that was just passed here in Illinois. So here is our product line. Our product line is a very professionally packaged. Our products are double certified and third-party validated, which means before they even hit your shelf, they are tested to ensure that the product is free from mold, mildew, heavy metals, and pesticides, and the product contains the appropriate level of cannabinoids and the appropriate level of THC, which is 0.3% or less. Our farms are growing organically industrial hemp. Our farms are sourced from Oregon, Colorado, and Kentucky. And we also have a farm in Northern Europe that's been growing industrial hemp for over 100 years. We also have a pure line. Our power line, is a line that is in the black packaging or the black label. That is a full spectrum product, again with the legal limit of 0.3% or less of THC. Full spectrum means that we use the whole plant. I showed you some of the cannabinoids that were listed there. Along with those cannabinoids, it includes terpenes, and terpenes are what gives the plant its aroma. Terpenes also have medicinal properties in helping to decrease inflammation and pain, as well as flavonoids. The combination of that full spectrum product on a cellular level gives you an amazing potency to those symptoms that you're trying to resolve. Now, our pure line is our broad spectrum line. That is the line that has the white label. That line contains less than 0.0% THC. A broad spectrum product contains all of the cannabinoids minus that THC. This is a great line for those who have random drug screens at their job. So we're going to go through some of these products, and then I'm going to highlight also some ways that you can use these products if you suffer from not only endometriosis, but maybe menstrual pain or menstrual pain during your menstrual cycle, couldn't get that out, right? Or any other entity of chronic pain and inflammation that we see in endometriosis. So we're going to go over the fact that our products are products you can trust. We use some of the most rich medicinal hemp products that are fully compliant with the State Department of Agriculture regulations. Our products are industrial hemp registered, as well as our products are Farm Bill compliant. And what that means is that the Farm Bill, which was passed in 2018 by President Trump, states that CBD, which is extracted from industrial hemp, is no longer a Schedule I drug. It is now descheduled, and that means that it can be sold, consumed, and even cultivated in all 50 states. So our first product that I want to talk about is our Power Extreme Relief. This is a great product that you can use topically if you have menstrual cramps and if you have pain due to endometriosis. This product can be used right in the area of the abdomen, in the pelvic area, to reduce inflammation and pain. This product contains 0.3% or less of THC. It's 200 milligrams of CBD in a 15 ml bottle. And we also have a proprietary blend of very powerful organic essential oils, which include arnica, black seed, turmeric, eucalyptus, clove, cinnamon, peppermint. All of these organic essential oils do what? They have an anti-inflammatory property that enhance the anti-inflammatory properties of CBD. So a great, great product to use topically for inflammation and analgesic control. Our other power relief product is our 500 milligram product, which is in a 60 ml jar, again offering relief topically for those who have menstrual cramps or pain due to endometriosis. This is a great way, again, to apply CBD to get local relief from areas that cause discomfort. Now, our power product, our Power Hemp MD, is our most concentrated tincture. It is a 750 milligram in a 15 ml bottle. This is our most concentrated product. In fact, a lot of physician offices and pharmacies like this product because of its high potency. It comes in a tincture form, which means you can place it underneath the tongue and hold it for a minute before you swallow to ensure that this CBD is getting into the bloodstream. Again, this product is very unique. No other products in the marketplace has this proprietary formulation that includes black seed, turmeric, and peppermint. Again, these 3 certified organic essential oils do what? They have anti-inflammatory properties that enhance the anti-inflammatory properties of CBD. Now, the recommended dose for our Hempranium MD is 3 drops twice a day, which is our daily support. That will give you 15 milligrams of CBD, or 8 drops twice a day, which is our health support. That will give you 40 milligrams of CBD, or 15 drops twice a day. That's the maximum support that will give you 75 milligrams per day. So we're going to stop sharing the slides for a second. Give me 1 second so we can stop sharing, and we can take me off of video so we can continue with our product line. So we are going to continue with our power line. I always like to give a live demonstration. Our next product is and we see my doctor colleague in the background, right? Our next product is our Power Hempranium 500 milligrams. This 500 milligram is a less concentrated tincture than the Hempranium MD, but it still gives you those certified organic essential oils, black seed, peppermint, and turmeric, that also enhances the anti-inflammatory properties of CBD. Again, this tincture you're going to place underneath your tongue. You can start out with 3 drops in the morning or 3 drops twice a day. You can increase that to 6 drops twice a day, and the maximum support is 15 drops a day. That would give you a maximum dose of 50 milligrams on a daily dose. Now, what's interesting is that the Mayo Clinic did a study, and the study showed that most patients don't need a lot of CBD. Most patients need between 2.5 to 25 milligrams a day to address inflammation, pain, and any other symptoms that you may be addressing. So that's why I stress with my patients, start low, start slow, more is not better. Our next product that I want to talk about is our Power Gummies. Oh my goodness, everyone loves gummies. Our gummies are a full spectrum product. Each gummy is 25 milligrams. Our gummies are not coated, but they're infused. When they're infused, that means that the CBD and the other cannabinoids are more potent because they are infused in the actual gummy. Our gummies are vegan, they're non-GMO, and one gummy is enough to address the same things that we talked about that CBD can address, from antibacterial to anti-anxiety to inflammation to analgesic pain control. Again, I love using these gummies with my patients at night because gummies take about 45 minutes to 90 minutes to get into the bloodstream. So that really allows time for you to take the gummy and to settle down at night to help with those symptoms that you are addressing. Now we have another product, which is our Power Water Soluble and our Power Culinary Plus. Our Power Culinary Plus is a great product to bake with, to cook with. Everyone loves infusing their brownies, their cookies. They love cooking with them. They love adding it to their dressing or their sauces. Again, more is not better. Starting with a low dose, 3 drops twice a day. If you need to double that or even increase it to the maximum dose, which is 15 drops twice a day. A great product, again, for those who have endometriosis, for those who have menstrual cramps, or for those who have any inflammatory issues, pain issues, sleep issues. Great, great product. What I love about the Culinary Plus is you can also use it as a tincture, which means you can place it underneath the tongue, holding this product underneath the tongue for a minute. The difference between this product and the Hempranium Power and Hempranium MD is that the Culinary Plus product does not contain those proprietary formulations of the essential organic oils like black seed, turmeric, and peppermint. This has no flavor, so it's a great way to bake and cook with, but it's great for those who don't want that flavor when they're holding it under their tongue as a tincture. So a really, really good product. So let's see if we can find my water-soluble product here. And our water-soluble product is a product that you can infuse your beverages, you can infuse your food, you can infuse your smoothies, you can infuse your sauces, you can infuse your cocktails and mocktails alike. And I think I found our water-soluble here. It's right here. So our Power Water Soluble, you can see, has a blue label. Blue is for water. It's a great product that you don't have to hold underneath your tongue as a tincture. It's a product you infuse your food and beverages with. Again, start low, start slow. 3 drops in the morning, 3 drops in the evening is a great starting dose. We also have another Power product that I want to demonstrate here, and that is our Power cartridge, our vape cartridges. I love our vape cartridges because vaping's onset of action is within a minute. Within 1 minute, you can get relief. 1, maybe 3 pulls on your vape is all you need. You don't need a lot in order to be effective. Let's talk about the vaping issue, because that's a really big issue, right, in the US. We've had about 13 deaths, hundreds and hundreds, unfortunately, of lung issues, mysterious lung issues. And after the FDA sampled these products, what they found was that these products are from the black market. They are from the street. They are from undisclosed areas that you don't want to get CBD or even cannabis from, right? These products, when they sampled, they found rat poison in these products. They found opioids. They found fentanyl. They found toxic chemicals. They found vitamin E. And you may ask, why would they put vitamin E in a vape cartridge? Well, vitamin E is a very, very cheap filler. So instead of using what we use at Wakana, MCT coconut oil, and we use hemp seed oil as our carrier oil, they're using vitamin E. When you heat up vitamin E, you know what happens? It becomes very toxic to the lungs. It causes a very, very serious lung condition. And over time, it can cause death. So what I love about our vape cartridges is that you can't open them. They are sealed. You cannot tamper. You cannot add anything. And they're full of organic CBD oil, which contains no rat poison, no vitamin E, no fentanyl, no opioids, just the pure organic CBD oil. That is important that you know, that you have to know your source, where you're getting products. And Wakana for Life products are the top potent and very safe and effective products that are double certified and third party validated, that you want to make sure that you have a reputable source. Now let's move on to our Pure product. Our Pure product is our water soluble product. It is a great product that's a broad spectrum product. And again, broad spectrum means that we have those cannabinoids that we talked about, like CBD and CBC and CBG and CBN, but we have less than 0.0% THC. So this is a great product. Any product that you see with the white label is a great product for those who have random drug screens at their job. This is a water soluble product. That means you can put it in your favorite beverages, your favorite food. If you want to use it orally, you can. It's not a tincture, so you don't have to hold it underneath the tongue. I love water solubles because when you're on the go, you can quickly get it into your system. Our Pure products also have an enhanced delivery system. It's called nanotechnology. Nanotechnology is a delivery system that increases the bioavailability, which means it gets into the cells very quickly and efficiently. Our other product that I want to talk about is our Pure gummies. Our Pure gummies, again, are 25 milligrams of CBD. Our products are not coated, they are infused. It's really important to know they're vegan, non-GMO, and each gummy, again, is 25 milligrams. You only need one gummy to address the issue, okay? So as we move on to our last part of the presentation, and that is the most exciting part, and that is the part on our next steps. What are our action steps? Well, there are many ways that you can get our product. One way is to come in with a personal use dispensary. This is a dispensary which gives you an assortment of all of our products. It will give you, well, not every single one of our products, but our most popular products. It will give you our tinctures, our Power tincture, our Power Culinary Plus, our Pure water soluble, our topicals, our Power vapes, and our gummies. It also gives you the ability to come in while you're using the products and make some extra money. We give you an online website. We give you the ability to share that website with others. And this personal dispensary is $299, but we give you $500 worth of product. So it's a great way to get in, start using our products, start sharing them maybe with your husband or wife or friends and coworkers. Now, the other way to come in to get our products and really get started in a side business or maybe a full-time business is our full crown jewel dispensary. This will give you $1,500 worth of products. It will give you 3 of those personal dispensaries we talked about. It will give you the opportunity to be a part of our Wakana University. Our Wakana University is the source of cannabis education and wealth creation. It'll give you 2 vouchers for that, as well as gives you the ability to be a broker, to have agents where you can give them as many online dispensaries or websites that you want. This full crown jewel dispensary is $998, and is a $2,000 value. So it's an exciting way to not only start the products, but you may be looking for a way to get into the cannabis industry, and this is a great, great way to do that. So right now I'm going to end the presentation. I'm going to open the line for questions, and the way I see questions are on our chat here. There's a chat button where you can actually type in your question if you have a question. You can also contact the person that invited you. We had over 91 people on this webinar tonight. So I want to thank you for your time, but absolutely you can contact the person that invited you. And I want you to do that because the person that invited you really cares about you and they really want to know if you were on the line. So give them a call before we end tonight. So the first question is, I suffered from endometriosis for over 20 years and she had stage 4. Stage 4 is a very severe level of endometriosis, and absolutely this is a great product for you to use to decrease inflammation, to address pain, as well as those who have endometriosis suffer from a lot of anxiety and depression. So this product will also help with anxiety and depression because it works on the dopamine and serotonin pathways in the brain. It also helps you to sleep. So many, many side benefits from taking our products, even if you have endometriosis, but it will definitely address other symptoms that you may have. A co-worker's wife just had a heart attack. What would be good for her? Well, we want to recommend that if someone has had a heart attack, someone who is on medication, someone who is under their doctor's care, that they first talk to their doctor before starting CBD. You want to make sure that person who just had a heart attack is stable and has gone through all of the 6-week post-heart attack follow-up before you start them on this product. Is the adult use pro? I don't understand that question. Is there any studies concerning CBD versus neuropathy or CBD with neuropathy? Absolutely. There are a lot of studies that you can Google, Grover. You can put in CBD neuropathy and hundreds of studies will come up that shows you that CBD helps with neuropathy by decreasing inflammation, by being neuroprotective, and protecting that nerve pain and reducing inflammation. So absolutely you can do that Google search and you will find a lot of information. Any other questions, you can put it right here in the chat. If I run a cannabis dispensary as a clinician, what would my biggest issue with personal and employment laws in Florida? Unfortunately, I don't know the answer to that, Angela. I would have to direct you to your representatives and your state legislators in Florida. I'm here in Illinois. If you want to run a CBD dispensary as a clinician in Florida, that's absolutely possible. CBD is legal in all 50 states, so you can absolutely open up your account here. You can open up an account with Wakana and absolutely share our CBD products with those in Florida. Any studies with CBD and Alzheimer's memory issues? Yes, Michelle. Again, you can do your due diligence and type in CBD and Alzheimer. CBD, there's many studies that show that CBD goes and decreases the inflammation in the glial cells that are causing a lot of memory loss in those with Alzheimer's. CBD also helps those Alzheimer's sleep, so it helps with their sleep, and it also helps with their irritability as well. So there's many, many side benefits that CBD has for those who are suffering from Alzheimer's disease. it will do a lot of good to get those patients a good night's rest. Any other questions? Can the topical be beneficial if mixed with massage oils for a masseuse? Absolutely, yes. Yes, you can use the CBD tinctures and mix it with massage oils, or you can use the topical pain relief or ointment and combine it with massage oils, and absolutely will help decrease the inflammation in the muscles. We see a lot of trainers that are using CBD. They're using CBD for pre and post workout recovery, for muscle recovery post workout, and they're using it for pre workout energy. So, really, a lot of excitement happening in the industry of trainers, physical trainers that are using CBD. Does it help with sleep? I'm up almost every 2 hours. Yes, Linda. CBD works on the dopamine and serotonin pathways in the brain, and it helps a person get into that restorative sleep, that REM sleep, that sleep that we need to restore and to heal our body. I would recommend, what I do is to take a gummy, 25 milligrams, either the power or the pure gummy, about 45 minutes before you're ready to shut it down at night, and you get a great, great good night's sleep. Great question. Any other questions? Well, great. That's all for tonight. If there's no other questions coming through that chat box, again, I want you to contact the person who invited you on this call. Someone invited you on the call. Someone loves you so much that I want you to take 5 minutes of your time and call them and let them know that you're ready to get started with our amazing products. That can be an individual product, that can be a personal dispensary that comes in a beautiful Wakana box, or that can be a full dispensary where you can get a lot of products, $1,500 worth of products. You can get the opportunity to get those vouchers for our Wakana University. Gives you the opportunity to start a business as well as getting those health benefits. So thank you so much. I want to invite you to attend next Tuesday. Next Wednesday. I'm already on Wednesday. Each Wednesday, I pick a different topic. Last week was arthritis. This week was endometriosis. Look out for our next topic. In fact, you can give me some suggestions by emailing me at drritamac@yahoo.com. Maybe you want to give me some suggestions for next week's topic. Again, my contact information is drritamac@yahoo.com. Again, whoever invited you on the call, they have my contact email as well. So if I was talking too fast, that's DRRITAMAC, M as in Mary, A as in Apple, C as in cat, @yahoo.com. Make it a Wakana evening, and we'll see you next week.